Wait for some of y'all to come up here. Yep, I'm doing 2 videos a day. Like I said, on my career job, which is being a nurse. Love nursing. Um, so my second video is very, very important to me, as it should be to a lot of people that work in upper management in this field, because as people, it's very important for us to treat each other with respect, especially in working in a professional setting. Quite often we go in these buildings where, yes, you're dressed in uniforms, but your uniforms are wrinkled. You just slouchy looking, hair not done. And I'm the pot calling the kettle black, because if y'all don't work with me before, I love my hair in a natural state. And whether that's a sideways afro, when I have my afro, my dreads not needing to be retwisted because this is terrible, y'all see. But I try my best to look presentable, period. This video is mainly going to be about why we quit our jobs, CNAs and nurses. I'm gonna wait till a few more people get up here. Hey, Wybry. Hey, Desmond. Hey, Shay. I know you're gonna stay tuned. Shay about to be my biggest fan, y'all, and I'm just starting this. She already on her second episode. So the topic for my second video is gonna be nurses and CNAs don't quit their job because of patients. They quit because of management. A lot of people will know, especially if you work with me, you've worked with in a nursing facility, whether it be a nursing home or whether it be a hospital, this is the main reason why we as healthcare workers quit our job for the most part. And mainly it's because of management. So let me ask y'all a question, and we can agree to disagree. How many of you have worked in buildings where you have a DON, you have an ADON, you have unit managers, and you feel like it's a clique? I'm gonna use the word clique like as in cliques in high school, cliques in middle school. This is what's transpiring on these jobs. If you don't know, there are a lot of cliques. What I mean by that is you are not noticed by your educational level in these facilities. You are not noticed or recognized. I'm not going to say noticed, but recognized, because a lot of people notice you, but a lot of people don't recognize. You are not recognized by your upper management as having intellect or knowing what you know in your field and you knowing it. A lot of these facilities focus on a like factor. And I'm going to tell you what I mean. And the click factor. I'll tell you what I mean. Okay. How many of you have been in buildings where you can go, you feel like you going to your manager on your floor and you're telling them, I have a certain problem. I've been having this problem and I feel like it's not getting any better. Did that manager attempt to fix the problem by holding a meeting about it, or, trying to alleviate the problem? Sometimes there's managers that are willing to fix a problem, and there's managers to just let that problem ride and keep going and keep going. When you allow a problem, such as, for example, I've been in management before. I really like being in management. Management opens your eyes up to a bigger picture in nursing. And what I mean by that is you learn who is who early on. You also learn who you can lean on for support. And what I mean by that is every person needs support, whether it's in your personal life or on your job. You learn the people that you can talk to about very personal things. And if you're having a hard time on your job, and with that being said, if you are a manager, have a person like that on your team, because it means a lot, you know. Somebody that you can just go to and vent and it won't go anywhere else, because we already know how these jobs can be, just like any other job. But anyway, not getting off the subject. CNAs and nurses quit these jobs because of management. Okay. If you don't know the job of a DON's job is to oversee the facility, follow up, make decisions based on the protocols of that facility and the procedures. They have a policy book. That's their job. They're supposed to make decisions regarding your employment there based off of policies set forth by that company. Okay. So if you're in these facilities where sometimes it is at the DON's discretion as to what rules they can make up, is what I'm gonna say. I don't like made up rules, because made up rules are personal rules to me. And I'm gonna say personal rules because some DONs function off their emotions. They don't lead by example. They lead strictly off of their emotions. If a DON cannot look you into your eyes when you go to her with a situation or a problem, she's not the right person for that job, number one. And I'm going to tell you that because a lot of her gestures, whether they be facial or physical gestures, depends on how capable she is of handling the situations. So like I said, that's the job of a DON, basically to oversee. Managers on your floor are supposed to be managing your building. You know, if a DON stays on the floor, she's pretty much micromanaging. A manager job is to manage the unit, and enforce the rules set by that's set by in the facility. So say somebody's been absent. They come in, you got the employees that come in when they want to come in. They pretty much run their floor because they coming in, they doing what they want to do. A manager's job is pretty much to monitor that for the DON and bring that to her attention. Because what can commonly occur is this CNA or this nurse is seeing this nurse absent this many days, and she feels as though no repercussions are being set. What that does is cause friction on your unit. You understand what I'm saying? So getting back to the situation of cliques, when you allow somebody, say you're a DON and you friends outside of the building with this person, nobody may know. Some people may know, but nobody may know. But how you treat your employees in your building depends on the success of your building. Don't it make sense though? I mean, I really think that makes sense. How you treat your employees on the inside of your building, that's how successful your building can be. If you're the type of DON that barely says good morning when somebody walks by you, you need help. I'm going to just say that. You have a lot of issues. You need help. Because if anything, you should be thankful every day that you have capable people in your building that's willing to get up out their bed every day and come work in that building and take care of your residents. Because ultimately, your license matters before mine. Your license matters before mine. How you treat your employees will indicate how successful your building can be. Because I'm going to tell you right now, I'm the type of nurse where if I know my DON is going hard for me, I'm going to go hard for her. Point blank, period. But it's some people that function in these cliques and they only depend on a few people. They're DONs that don't have to speak when they come in. They looking at you up and down. They're judging you from nothing. You understand what I'm saying? When you don't have any personable skills, some people that are qualified for the job aren't really qualified for the job. It's obvious. So you went to your management about a particular issue. If you have a problem, you know, if nurses or CNAs have problems with their managers or administrative staff. Depending on how that manager and DON react to that situation depends on whether or not the employee will further their employment with that facility. That's what that depends on. You know, you've been in the offices where you have a manager, it's the nurse, and it's the DON, and you feel like you're being attacked. First and foremost, I just want the nurses and CNAs to know that it is your right at all times. If you get pulled into an office situation where you feel like you're about to be put in an unfair situation, or if a meeting is starting where you're receiving a write-up, it is okay and it's always in your best interest to bring in a party on your side, whether it be a social worker or an administrative director or somebody that you feel like is going to be on your side and can witness for you. I'm gonna see if somebody watching. I wanted to include somebody in this because I wanted to ask a question to a CNA. I see a few CNAs watching, and I just wanted to ask the question, like, as a CNA, how do you feel when your manager or your DON is constantly having meetings and it's always about something negative that was done in the facility, whether or not your falls have increased, your wounds have increased, or, people not, how do you feel about the negative reinforcement in a nursing facility in correlation to the positive? Is it more negative than positive? I don't know. Let's see. Who we going to add? Who's on? That's a CNA. I'm going to invite Keisha. I don't know if she's going to answer her phone, though. Hey, Keish. Where you at? I'm not sure. What? Sonya watching, too. Hey, Sonya. Well, it don't look like nobody wants to come on. But anyway, in most situations, it's more negative that's talked about than positive. Just a bit of advice. If you are managing these facilities, provide some positive reinforcement and make it genuine. Make it genuine. Because nobody likes the fake, you know what I'm saying? Make it genuine. Do something positive for your staff to let them know that you appreciate them. And that's my videos for today. One love, Nada.